occur to anyone, anytime. For example, according to the Canadian Red Cross, a person gets injured and needs medical attention every 15 seconds. This shows us how essential it is for a medical student to apprehend and practice the fundamental steps of first aid. The aim of providing first aid is to preserve life at any cost, prevent further harm, and promote recovery. There was a study done in St. John Ambulance in 2010 on the general public. Out of 2,000 participants, 59% were not confident enough to carry out first aid procedures. Statistics show that people who participate in a first aid course can reduce their personal injuries up to 40%. Being an important part of the healthcare system in any country, it is a medical student's great responsibility in preserving life. This requires preliminary knowledge of first aid. There was a questionnaire circulated among medical students in Kanazawa University in Japan regarding performing CPR. It surprisingly concluded that 16% were willing to perform, many others claiming that they were not able to due to lack of knowledge. Keeping this in mind, the initial and most fundamental step in coping with any casualty is awareness of first aid protocol. This notion can make a huge difference between life and death. The lack of etiquette training of first aid among students of Dow Medical College calls for an assessment and evaluation of first aid education. This brings us to the objective of our studies, which is 1, to assess the knowledge of first aid among medical students of Dow Medical College, 2, recognize the aspects of first aid which require further attention, and 3, to make necessary adjustments in the training of students with regards to first aid. I now call upon Oscar Bisbee to discuss the methodology and results. Thank you.
Thank you, Fatma. My name is Oscar Bisbee, Assalamualaikum, and I will be presenting the methodology and results portion of our presentation. As you can see, our study time period spans from May to June 2011. And during that time, we gave out a questionnaire to the students of DMC. Our study design was a cross-sectional study, and 325 students participated in our study. The sampling technique was convenient sampling. Inclusion criteria consisted of any students ranging from first year to final year. We chose 65 students from each year to participate. Anyone, irrespective of whether they were male or female, were included, and whether they had prior first aid training or not, everyone was able to participate. Exclusion criteria was anyone who was not willing to partake in the study, they were not included. For data collection procedure, we composed a 15 multiple choice scenario-based questionnaire, which were structured according to the guidelines found in Mayo Clinic and Medline websites. While doing our research, I came across a small story, a brief story about a children's classroom, which was where a first aid session was being held up. And the first aid instructor asked the students, what would you do if your younger child sibling was to swallow your house key? A child replied saying that I would climb in through the window. Well, that was just a child answer. However, we were assessing the knowledge of medical students, and our questionnaire was based on a more serious scale. So our questionnaire dealt with questions on CPR, basic first aid, CPR, choking, burns, convulsions, and miscellaneous topics such as nosebleeds, other bleeding situations, and snake bites. The questionnaire, like I said, was distributed to 65 students from each year. And upon taking the questionnaire, prior to it, they were required to sign a consent form, and they were also briefed on the purpose of our study. They were each given 10 minutes to take the questionnaire and sign the consent form. 15 questions were in total on the questionnaire, and out of that, you had to at least answer 8 correctly in order to be considered as passing. Also, we had a specific number of questions on each category. For example, there were 3 questions on CPR and 1 choking, and you had to get a specific number of questions correct in order to qualify as passing example, there were 3 questions on CPR, so you had to get at least 2 right in order to qualify as passing on in the CPR category and 1 right in the choking category so that you can qualify to pass. This way we were able to assess not only the students' knowledge on first aid as a whole, but also their knowledge in subcategories of first aid. Also, any answer that was marked unmarked or was not answered or they answered incorrectly was awarded 0 marks. There was no negative marking. For our statistical analysis, we used SPSS version 16.0 software, which calculated our means and frequencies. That was some of our methodology section. Moving on to the next portion would be our results. So in total, 325 students participated in this study, and in figure 1, you can see the percentage of the students who were able to pass and to fail. The blue portion are the students who failed, and the red portion are the students who passed. You can see that the 31% of students were able to pass and 69% failed. Moving on to figure 2, we see that 67.7% claimed that they had prior first aid training, and 32.3% said that they did not have first aid training. From this, we can see that even though the majority of the students were trained in first aid, only 31% were able to pass, which was very poor results. Also, we see in the next that in each year how the students were able to score on the questionnaire. We see that in the first year, there was 23.1% of the students passed who took the questionnaire. Also, in second year, 18.2%, but in third year, you see an all-time low, which would be 13%. Then in fourth year, you see a boom, and it goes to 40%, and final year, 46% of the students were able to pass. In figure 4, we see the category, in each category how the students scored. In CPR, they scored fairly well. 86.9% were able to pass. Also in birth and convulsions, 75 to 59% of students were able to pass. However, in factors, choking, and other miscellaneous topics, people were not able to score that well, ranging from 43 to 30% of passing. From this, we can easily see that only out of all the students who took the survey from each year, not even 50% of the students from each year were able to pass. That would conclude our results portion, and now I would like to call up upon Hassan Iftikhar to continue with the conclusion and discussion.
Asya, nice job, Asya.
Thank you, Asya. My name is Hassan Iftikhar. Assalamu alaikum everyone. I will be presenting the discussion and conclusion part of our presentation. My colleagues Fatma and Asya presented to you the rationale, objective, the results, methodology, everything. And based on all of that, we have arrived at a few conclusions. And based on all those conclusions, are some discussion that I will be presenting to you. The first conclusion that we have arrived at is a very overall conclusion, which is that the knowledge and expertise level regarding first aid in the medical students out here in DMC is very low. And then secondly, when we divide the students based on which year of medical education they are enrolled in, and then we look for patterns, we find that the first years were scoring significantly higher than the second years, and then the second years are scoring significantly higher than the third years. That was surprising to us, because we would have expected the third years to score better than the junior years. So can that be explained? Well, I think so that can be. Each student in Dow Medical College from first year right up to fourth year are receiving 2 classes of first aid training in their first semester. Now for the first year students, that was fairly recent. That was just around like 1 year or 6 months back. But for second year students and for third year students, that was not so recent. And so we see a progressive decline with the amount of time that has elapsed since the last training session. So that's why we see, or we can assume we see gradual decline. Fourth year students, we see one another boom, and then fifth year students that carries on. So we can, another factor I would like to say comes into play, and that is the exposure to clinical knowledge and solid